Okay, so in this video I'm going to talk about the palpations of the knee. And so you can find this on page 45, 46, and 47 in your book, your competency book. So the best way to start with palpations is to kind of find the squishy part. Everybody has a squishy part in your knee. So if you have them sit with their knee bent and you feel here in the squishy part of Madison's knee, I didn't warn her about that. If I go up, I'm on the medial femoral condyle, which is your first one. Madison, stop. And then if I go up on the lateral side, that's your lateral femoral condyle. And you can feel squishy here and then bony as you go up. And this whole thing is the condyle. Okay. Then if I'm back in my squishy spot and I come down here, I'm on the medial tibial condyle. Again, everybody's knee is different. Some people are going to be really bony and it's going to be obvious there. And then if I come back over here and I go down, that is the lateral tibial condyle. So on the medial tibial condyle, I have an area called pes and serine, and that's this right here. Remember, I have three muscles that attach there. The sartorius, the semitendinosus, and the gracilis are all going to come in and attach right here. Gerdy's tubercle is a bump on the front of the lateral tibial condyle. Madison's is pretty obvious. I don't know if you can see it on the video, but this bump right here is her Gerdy's tubercle. It's commonly mistaken as the fibular head, so you have to find, it's easiest if you find their fibular head and Gerdy's and know the difference. Like, this is her fibular head and this is her Gerdy's tubercle. They're normally pretty obvious bumps on the lateral side. Then your tibial tuberosity is this bump on the front of your shin. Some people have a larger bump there because they had Osgood slaughters, because they went through a quick growth spurt. Back where we were at when we started, those are considered the joint lines. So if this is my femur and this is my tibia, the space between them is the joint line. So this is my medial joint line and it goes all the way around there. This is the lateral joint line and it goes all the way around here. In that joint line you can find the meniscus, which we'll talk about in a second. Then we need to talk about the patella itself. So if she scooch forward a smidge and then put your leg straightish. So here is her patella. Just relax your foot. This is her inferior pole of her patella. This is the superior pole of her patella. And then I already did fibular head, but it's easiest if you find them together, like I said. This is Gerdy's tubercle, and this is fibular head. Now we're going to talk about the ligaments. The medial collateral ligament is going to be a big band here, but you can't necessarily feel it. You just know it's on the medial side, connecting the femur to the tibia. Then your lateral collateral you can feel if you put them in the right position. So if I have her sit in a figure 4 position and let her leg fall out, and I go to that joint line, so here's that squishy space, you can kind of see I can push in there, and then when I get back here, I feel a ropey structure. It sits just like this. That rope is her lateral collateral ligament. Now if we go back to that, you can scooch back a smidge. We go back to that squishy space. This was the medial joint line. It's where you find the medial meniscus. Remember, that's the shock absorber of your knee. Then this is your lateral joint line and where you find your lateral meniscus. Now we have 3 bursa that we're going to talk about. You have a lot of bursa in your knee, but we're going to find 3 of them. So you need to keep med term in mind. Okay, so sorry about that, technical difficulties, but I stopped at the suprapatellar bursa, which is above the patella. And then pre-patella, so if you think about pre meaning before I touch the patella, I would touch the pre-patella bursa. And we'll talk about that with bursitis. And then because there's so much here, you have to have your own dedicated bursa at the pes and serine. So over the pes and serine is the pes and serine bursa. And then your patella tendon is this right here. It goes from the inferior pole of the patella to the tibial tuberosity. And it's this right here. Now I'm going to have her stand up and we're going to talk about muscles. So on her thigh, we have her quadriceps muscles. So they're, the vastus lateralis is the most lateral quad. So if she squeezes her quad really tight, you can see the end of it right here. Then her rectus femoris goes right up and down the middle. It's really flat. You can't see a strong definition of it. Vastus medialis is this medial quadricep, and when she squeezes her quad really tight, this one, Maddie, we want to see this rounded thing at the end, and that's the VMO portion. Now, I do have some adductors on there that you don't need to know, so go ahead and cross off adductor longus and adductor magnus. I must have forgot to take those out. But our gracilis is going to be, open your legs up. Our gracilis is long and skinny, and it comes down to the pes anserine, so it's right down the inseam of her pant leg if she had on pants. And then the sartorius starts up here on her hip, and it's going to come across like a seatbelt to the pes anserine. Okay? And then you can also cross off tensor fascia lata, because I'm not going to ask you that one either. But I will ask you the IT band. So if she stands sideways, this definition right here, you can see the difference between her quad and her hamstrings in this flat spot, that's her IT band. Then her hamstrings, biceps femoris is most lateral, semitendinosus goes down the middle and wraps around to the pes anserine. Semimembranosus is more medial. So if I have her pull her leg up and hold it there, you could see her hamstring tendon pop out right there. That's her biceps femoris. And then her semitendinosus you can feel here. And semimembranosus feels more meaty here. And then her gastrocnemius is her calf. So those are the palpations.